Okay, good afternoon. This is the presentation regarding COVID-19 and how to safely navigate this pandemic throughout Triton Regional School District. So what we know about COVID-19 at this point is it is a respiratory virus that spreads directly through droplets. Antibiotics are not effective against COVID-19 because it is a virus. So only if there is a secondary bacterial infection will antibiotics help that infection, but it will still not improve your COVID-19 symptoms. COVID-19 is extremely contagious, as we know, and at this point, there's no vaccine. However, they're working diligently and are very close. Most people recover from this illness. Approximately 96.7% in the U.S. recover from COVID-19. They are finding people with comorbidities and different illnesses on top of COVID-19 are most at risk. All recommended vaccines should continue to be up to date. And recently there is a new mandate that all children going back and returning to school and potentially all staff, that has not come out yet, will need the flu vaccine. But at this point, all children returning to school will need the flu vaccine prior to coming back. Children generally have milder or no symptoms, so they're considered asymptomatic at times. But it is found that children are actually harboring more of the virus in their nasal passages and therefore can transmit the illness. So transmission, it's person to person through respiratory droplets produced when an infected person sneezes, coughs, or talks. This is why we have to be diligent about wearing our masks for protection. So usually COVID-19 is transmitted when in close proximity to an infected person. This is why we will continue to maintain the 6-foot distance recommended by the CDC. Respiratory droplets can land in the nose, mouth, or eyes and can be also inhaled directly into the lungs of the non-infected person. The droplets, once they land, do not crawl, they do not fly. This is why it's important that if respiratory droplets land on our hands and we touch our nose, mouth, eyes, face, we are at risk for infection. This is why hand sanitizing and hand washing with soap and water is the most effective way, and also to wear a mask at not getting this virus. Droplets can remain suspended in the air for many hours. And people who are infected may be asymptomatic again, but still can transmit the virus. So how do we mitigate the transmission of COVID-19, especially within a school setting? We're going to continue. All students and staff will wear masks. We will not touch our eyes, our nose, our mouth. We will wash our hands often, especially before and after meals, after toileting, which we should be doing anyways, but we need to be really diligent about how long and how often we're going to wash our hands. You should be washing your hands for at least 20 seconds, 2 rounds of happy birthday, 2 rounds of ABCs. You have to wash every surface. Don't forget your thumbs around your fingernails. And hand sanitizing with alcohol based of 62% or greater is recommended. And you must hand sanitize until your hands are completely dry. So if you're unable to wash with soap and water, you use the hand sanitizer. You rub your hands, all of those surfaces around your fingernails, around your thumbs, wrists, until the hand sanitizer is completely dry. We're going to disinfect surfaces frequently throughout the day: desks, countertops, doorknobs, keyboards, any hands-on learning items, faucet handles, toys, cell phones. A good trick, which is also at the end of this presentation, is to place your cell phone in a plastic bag so you're never actually touching your cell phone. And you're also going to limit sharing or disinfect between sharing. Continue to maintain that 6-foot distance. This is a demonstration of how we take off gloves so that you're not touching the soiled glove with your bare hand, and we can demonstrate that now. So before putting your gloves on, it's always good to wash your hands with soap and water first. If soap and water is not available, you're going to use hand sanitizer, and you're going to rub in all surfaces of your hand. Don't forget your thumbs and around your nail beds, and you have to rub hand sanitizer in until it's completely dry. If you wash your hands soap and water, make sure to dry your hands appropriately with disposable paper towels, and then you're going to put your gloves on. And the important thing is when we take our gloves off, you don't want to touch the soiled portion of the glove. So if you imagine germs on the outside of your gloves, you don't want to touch that. So to take it off, you touch the outside of the glove with your gloved hand, because now we consider these both dirty. So this is dirty, this is dirty. So you're going to take your dirty hand and touch the dirty surface of the glove and remove it. Then, now you have a clean hand, but you don't now want to touch the dirty. So you have to loop your finger underneath, because the inside of your glove is clean. So you can use, I use my thumb, but you can use whatever finger you want. You get underneath so you're not touching the dirty portion. Hold that other glove in your hand and pull. Now it's inside out, so I can touch it with my clean hands because the inside of the glove is clean. And then you dispose of it in a trash barrel. And then wash your hands again with soap and water or sanitize. And that's how you put on and take off gloves.
This slide shows proper face mask use. So you'll see people walking through the stores with their face mask under their nose, above their chin. That is incorrect. The mask has to cover your nose and cover your chin. You want to pinch the top of the mask, if you're wearing a surgical mask, with your fingers, your clean fingers that you've just washed, over your nose, so you have a nice seal around your nose as well. So before putting your mask on, you're always going to wash your hands. And you're going to handle the face mask by the ear loops or ties, whichever your mask has, and we will demonstrate that as well.
So now, before we put on a mask, our face covering, you have to wash your hands first again. So soap and water is ideal, or hand sanitizer if that's not available. And again, you want to rub in the hand sanitizer until your hands are completely dry, remembering your thumbs and your nail beds until that hand sanitizer is dry. You touch the mask only with the ear loops. You do not touch the front of the mask, and you're going to put the mask on around your ears. The mask is to cover your chin, and you're going to pinch around your nose. So you have a seal around your nose, it's going around your ears, and it's down around your chin. It is not to be like this, and it's not to be, which is impossible anyways because it covers your eyes, but not to be above your chin. So around your chin, pinch your nose, and around your ears, like that. When you remove it, again, if you have gloves on, you take your gloves off, wash your hands. You should always have clean hands before touching your mask because it's near your face. So wash your hands or hand sanitize. Take it by the ear loops again and remove it. If you're throwing it in the trash, you may do that, or you can keep it in a plastic bag. Some people are going to hang it on their lanyard as well. So those are just a couple options of where you want to put your mask when you're having a mask break. You're going to dispose of these at the end of the day, and cloth coverings you're going to wash at the end of every day. And that's how you put on and take off a mask.
So N95 masks are recommended only if nurses and staff will be in contact with a suspected COVID-19 positive case and or performing aerosol generating procedures, which in the school setting at this point, we are not going to do. That would be nebulizer treatments in the school health office, but we are not doing that with COVID-19 at the current time. So N95s will only be worn by nurses and staff in direct contact with a positive COVID-19 student or staff member. However, if you are more comfortable, maybe you have asthma or have respiratory illnesses and you feel more comfortable wearing an N95, you certainly may do so. You will have to get your N95 fit tested. Face shields are required to be worn by nurses and staff, again, when supporting students that may have been suspected COVID positive, but also for those in close proximity when physical distancing is not possible, when they may be in direct contact with bodily fluids, such as toileting a student. This is a step-by-step of how to put on or don your PPE equipment, and the second area on the slide is how to remove your PPE equipment, and we can demonstrate that now.
First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again, perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
So just a few definitions, quarantine versus isolation. People get confused about this. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. So basically, quarantining is you're gonna stay home for that period of time. Isolation actually separates sick people. So although your whole family may be staying home, isolation would be the person with COVID-19 is actually separate from everybody else in the family. They stay in one room, door closed, if that makes sense. So isolation separates sick people with a contagious disease from people who are not sick. So general guidelines, so you know when you enter the school, our health offices are going to be set up a little bit differently. Each school is going to have a medical waiting area. That's for suspected COVID patients, students that are exhibiting symptoms of COVID-19. And then we're going to have a separate wellness suite. This is for our daily maintenance, our daily medication, our diabetic treatments, any injuries we might see, cuts, bruises, and that sort of thing. Students with social emotional issues will notify the school. The school adjustment counselor should be notified, social worker, counselor, or the main office for further assistance. You're going to have to call the nurse for all non-scheduled health office visits and wellness concerns before sending students. So the days of free sending students to the health office have officially ended, and you will only send students after actually speaking with the nurse so that we can triage over the phone what room they're going to go to. If they seem like they may have a symptom of COVID-19, they will come down to the health office, we'll meet them in the hall, and we will proceed to the sick room or the medical waiting room. And if it's a cut or a bruise or something that doesn't need to be in a medical waiting area, we will assist them to go to the wellness room. All scheduled health visits, such as daily medications, routine diabetic care, medical device maintenance, you do not need to call. We're aware they come down at certain times during the day, so they can make their way down at their specific time to the wellness area. So this is for you to know the possible COVID-19 symptoms, which there are many. Feeling unwell, cough, shortness of breath or difficulty breathing, body aches, chills, sweating. They've changed it recently. They've dropped the temperature to 100 degrees. So any temperature 100 degrees or greater, which you wouldn't know until they come to us, is a symptom. Muscle pain, headache, chills or repeated shaking or shaking from the chills, runny nose, congestion, sore throat, new loss of taste or smell, nausea, vomiting, diarrhea, or rash. So urgent care, when to call or page the nurse. Any sort of suspected anaphylaxis, asthma issues, trouble breathing, dizziness, fainting, student with diabetes in need of care, head trauma, concussion management, bleeding injury, burn, new orthopedic injury such as a sprain or suspected fracture, seizure activity, or eye injury. These are just examples of when we're going to need to be paged immediately. And teacher first aid kits will be distributed at the start of school, and you just notify us when your supply is low, and we can get that out to you. So some practical suggestions. It's good to leave your work shoes in your car or outside your house. You can bag them in a plastic bag as well. Place your cell phone in a plastic bag so you're not ever really touching your actual cell phone. Change your clothes and shower upon returning home. Launder your clothes. Get some headbands with buttons to hook your ear mask or ear loops on. Facial wipes are your friend. Wiping your face every few hours when you get a break from your mask. And keep sanitizing wipes and hand sanitizer in your car. Wipe down your keys, ID badge, watch, and phone down. Keep as much as you can in your trunk to minimize what you bring into your house. I personally am going to wear scrubs to school, so that's always an option as well. Miscellaneous considerations. Keeping up with attendance and seating charts will be crucial this year, so you need to know who's sitting where and who is in your class at what time. We will have sign-in sheets on the door of every classroom so that we know who and when and what time they entered the room, and this is all for contact tracing. Confidentiality must also be followed. If you become aware of a confirmed COVID positive case, you have to notify the school nurse, and then school nurses will be in contact as needed with the local Board of Health and will update the district as needed. And those are just a couple of resources. So that is the presentation regarding COVID-19 for Triton School District. It is changing, so we will update you as needed. If you have any questions, feel free to contact your school nurse, and we are happy to answer questions as we can.